While there is still so much to be learned about COVID, we do know that those with certain health conditions like asthma are at greater risk of complications. And it's not just COVID they need to be wary about. We learn more today in this segment sponsored by Buckeye Health Plan. Dr. Michelle Blanda is the medical director of Buckeye Health Plan, joining me today. Good to have you on the show, doctor.
Thank you. Good to be here.
So today we're focusing on asthma and really the complications that can come along with it. So let's start with the basic definition of what exactly asthma means for the patient.
So asthma is a chronic respiratory disease, and it causes airways to narrow and swell, and many times people will produce extra mucus and makes it difficult to breathe. And it's usually caused by an irritant of some sort. And many times patients will have coughing, wheezing, shortness of breath, and chest tightness.
And how many Americans are impacted by asthma, or really Ohioans?
So people who have asthma, it's a pretty common respiratory disease. And in Ohio, over 1 million Ohioans have chronic respiratory conditions like asthma. 1 in 10 adults and 1 in 7 children. So most of us know somebody with asthma.
Okay, and we are dealing obviously with viruses like COVID, like the seasonal flu on top of this. So what are the increased risks for someone with asthma? First, let's focus on if they were to get COVID-19.
So I said, it's hard to talk about flu when everybody is so absorbed with the COVID pandemic. But we have to remember that the COVID-19 cases are rising again. And we know that it is anticipated that we're going to have COVID around for about 1 to 2 more years. And so now with flu, we have kind of like the double threat for respiratory illnesses. But we know that COVID targets the lungs. And so people with lung conditions are more likely to develop severe symptoms if they get COVID. And people who have moderate or severe asthma are more likely to be hospitalized. And that's the same for flu. People who have asthma, if they get the flu, even if they have mild symptoms, many times it can trigger their asthma and make it worse. And we know that children and adults who have flu are more likely to get pneumonia after they get sick with the flu. So it's critical that people understand the risks and take steps to keep their asthma under control and to avoid infections.
And Dr. Blanda, what about triggers? Should people know what sets their asthma off?
People definitely need to know what sets off their asthma. And remember that for different people, the triggers may be different. For some people, it could be dust and animal dander or smoke. For some people, it's going to be cold weather and exercise or irritants like perfumes or fumes. So we encourage everyone to identify your triggers and to eliminate them as much as possible.
And obviously, when it comes to COVID, you are encouraging anyone with asthma especially to get vaccinated.
Right. We want patients to take their medication. We want to know when they take their medication. But the most important thing is to not let your asthma flare. And we know infections can make your asthma flare. And so it's essential that people get the COVID vaccine, they get their annual flu shot. And for some patients, they may need a pneumococcal vaccine. So we encourage everyone to take those steps to protect themselves from COVID and the flu.
Dr. Blanda, to that end, you like to talk about prevention with your patients. You even have Buckeye's care management program for asthma. So what exactly is involved when it comes to trying to prevent some of these illnesses?
Well, we want patients to be involved in their asthma care. And so we encourage the use of an asthma action plan. And it is actually a written plan, and it has different steps in it. And we sometimes label them green, yellow, and red. So green means that your asthma is pretty well controlled. You're doing pretty good. Nothing's flaring it. Yellow means maybe it got into pollen season or you got a cold and now your asthma is flaring and you have to take different actions. And then red is obviously when your asthma is getting quite severe and you may have to go to the hospital. And obviously we want to avoid people going to the hospital with asthma. People don't think that people die of asthma, but they do. And it's quite tragic to see young people die of asthma. So the plan hopefully guides patients and lets them be able to have a sense about what is going on with their disease and know what to do when they get into signs of trouble.
Okay, so it is always best, of course, to talk to your doctor. To find a provider with Buckeye Health Plan, you can go to the website, which is just buckeyehealthplan.com. So very easy to remember there. Doctor, thank you so much for bringing us that education today.
You're welcome. It was a pleasure.